Good morning, Francesca Canzano-Franklin here. I am honored to be able to be here today celebrating Global Wellness Day. I have a background in Eastern therapies, Chinese medicine, acupuncture, yoga, Thai yoga, and I am a strong believer in movement, in exercise, in flow, and in stretching. And today I'm here to take you through a mini home ritual using a Gua Sha board that you'll be able to incorporate into your home care routines. All you will need is a Gua Sha stone, any type or any shape, and a face oil, possibly a natural oil. We shall be starting from the chin region, and I will show you a few techniques on how to depuff the face, but more importantly, how to activate the lymph in your face and in your neck. So we shall be starting by applying a Gua Sha board inferior to your chin region, flat, just like so. And I will be asking you to tap ever so lightly between 5, 15, 20 times, just like so. In between, while we do the tapping techniques, I will ask you to inhale deeply and exhale. We'll do that just now in a second. After we've done so, we will be collecting any excess lymph by bringing it down with a feather-like technique, especially on the mid part of the neck, bringing the lymph down to the base of the neck. We'll then lightly move the stone laterally to the mid area, and we'll be doing exactly the same thing. So tapping the stone ever so lightly with the stone as flat as possible, 5, 10, 15, 20 times. And this time we'll collect the lymph and we'll bring it down to what we call anatomically the terminus region. Just like so, about 3 to 5 times. We then move closer to the ear region, tapping once again with the stone as flat as possible, just like so. Not forgetting to breathe. We'll repeat in a second to the opposite side, and I'll guide you through with the breathing as well. And once again, we'll collect the lymph and bring it down to the terminus region. Anterior and posterior to the ear region, you can insert your stone just like so, or any type of stone, or your fingers if you don't have a stone that allows for this technique. And ever so lightly, once again, we'll be tapping on the lymph nodes present anterior, posterior, and inferior, just stimulating them. 10, 5, 10, 15, 20 times. And again, super lightly, you can assist yourself with the opposite hand as well, stimulating the flow of the lymphatic system. So lymph is always flowing from top down. We then repeat exactly the same thing. So once again, the stone is flat, tapping 5, 10, 15, 20 times, making sure that we are inhaling deeply and exhaling while we bring the lymph down at the base of the neck. We then move once again laterally, so to the opposite side. And once again, 5 to 20 times, stone flat, tapping on lymphatic nodes present at the base of the chin area. Always remembering to breathe. So while I tap, I can inhale. And while I exhale, I will be bringing the lymph down into what we call the terminus region. Once again, tapping 5 to 20 times, inhaling while we do so, exhaling while we descend the lymph into what we call the terminus region. Once again, same as to the opposite side, we'll be tapping about 5 to 20 times, ever so lightly on the lymph nodes, stimulating them, reawaking them in order to create flow and bringing the lymph down into the terminus region once again. We then apply the same techniques to the back of the neck. So first I will ask you to tilt your head forward and backwards and apply the stone, whichever stone you may be using, at the back of your neck where the occipital region is. Ever so lightly, just like we did before, I'll be asking you to tap, 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 so 5 to 20 times. And then once again, we bring all the lymph down to the neck. So I'm literally on top of cervical 1, moving down to C7. And I then move laterally, so tapping individually for each area. I'll be repeating exactly the same thing to the opposite side. So posterior to the occipital region 5 to 20 times, and then moving my stone down about 5 flowy movements down and bringing the lymph towards the terminus region. I'll come back to the mid part once again, so tapping just like so at the back, ever so lightly stimulating the lymphatic system and moving the lymph down onto our spine from C1 to C7, which is present at the base of our neck. And then we repeat laterally but posterior, so inferior to the back of the head, just like so, where the occipital region is. And we move the lymph down just like so, and you can also assist yourself with your other hand. While we do so, always remember to inhale while we tap it and exhale while we bring the lymph down towards the terminus region. We then take our stone, with whichever part of the stone you may have, into the area that in Chinese medicine we call yin tang, or the third eye, and we'll be recreating 5, 15, 20 little circles going clockwise. So if you may, close your eyes, take a deep breath here, and exhale about 2 to 3 times, and then we reverse the technique, always remembering to breathe. And then if you have a Gua Sha stone that allows for it, you may use the indentation part. Otherwise, whichever part of your stone will be absolutely perfect. I will ask you to ever so lightly pull up the skin and then gently scrape the mid part of the forehead, either with a flat board or, if you have one, with the indentation part. So lightly, about 5, 15, 20 times. Now the stone is as flat as possible. And then I move along one side of my forehead and I will be moving the opposite side of the forehead. Now this lightly scraping technique assists with microcirculation of the skin, oxygenation, blood, but also for any possible tension that we may have on the upper part of our faces. So I've just worked on the midline, move laterally and ever so lightly come back to the mid area, always ever so lightly pulling my skin up and moving bilaterally. And just remember to have your stone as flat as possible, just like so. After the light scraping technique, we will use whichever part of our stones to collect lymph, just like so. So from the base, where the yin tang point or our third eye is, up 3 to 5 times in a flowy movement, and then we take any excess lymph laterally into a nice effleurage massage technique to then bring it down anterior to the ear region. We tap once again 10 to 15 times, ever so lightly. We stimulate once again lymph nodes here, 5 to 15 times. We then tap once again inferior to the chin area, just like so. And we bring all the excess lymph, or the flow of lymph in this case, down to the terminus region here. And we repeat to the opposite side. So nice, gentle flowing techniques. Just like so. As you can see, I'm always assisting myself with my other hand to create flow. Move the lymph laterally and down in front of the ear region. We then tap ever so lightly, about 5 to 20 times to stimulate the lymph node. Then we tap once again at the base of the lateral side of the chin, just like so, 5 to 20 times. And then we bring the lymph down into the terminus region once again. We then move from the yin tongue region, we move inferior to the corrugator muscle or our eyebrow muscle. We do little circular motions here or pressure points, super lightly with my stone as flat as possible, just like so. Just awakening the muscle and releasing any possible stress. Repeat the same to the opposite side. So ever so lightly pressure points all along, so medial to lateral. These techniques are excellent to release any tension, especially the ones of us that have been spending too much time in front of a screen this year, computers and so on, or people that wear glasses, or the kind of stress, tension that we get towards the end of the day. And then we collect any excess lymph with the stone as flat as possible. And again, we bring it down anterior to the ear region, tap inferior, and bring everything down to the terminus region. And we repeat to the opposite side. So pressure points, slowly. I'm just rushing here because I've already shown this technique. And then in front of the ear region, tap, 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 inferior, and down to the terminus region. We then use whichever stone you may have to do a lot of lymphatic drainage to our face. So starting from the nose, so medial to the nose, with the stone as flat as possible. Ever so lightly, but also slow. We collect any possible lymph, any excess lymph, any stagnant lymph. We create flow and movement. This in itself could be an hour treatment. Collect all along the face. Also superior to the mouth region, inferior to the lips. Tap once again, tap inferior, drain down. We then repeat exactly the same technique to the opposite side, either with the same hand or you switch hands. The movements are slow, gentle, and flowy. While we collect all the lymph, don't forget the lips, superior, inferior to the mouth region, without dragging the skin. This is the most important thing. We're literally just collecting the excess lymph, tapping anterior, tapping inferior, and bringing it down to the terminus region. The eye region as well, you can spend a little more time, again with any stone, not using the indentation part. In this case, I'm using this round area, and ever so lightly collecting lymph, however many times you wish to do so, but ever so light and gentle techniques. and then you collect and you bring down everything again. Then you repeat to the opposite side as well. However many times you wish to do so, and bring everything down. 2 beautiful points to incorporate this ritual if I still have time. The bladder 2 points. You can either work them simultaneously or individually, so one at a time. They're excellent together with our large intestine 20 point to depuff, but also to open up the pathway from the top part of the face to the lower part of the face, and excellent for depuffing as well. Just like so. So we just quickly to recap. Bladder 2 points, connecting either side of our face. Large intestine 20, which sits lateral to the nose, connecting these 2 points. It's beautiful to open up and clear up the nose pathways. Great for allergies, but also to depuff our face. And then, as always, gentle and light collection of lymph in order to create flow. And exactly the same thing to the opposite side. Always remember to inhale, exhale down, press lateral to the nose, and lymphatic drainage techniques. Tap anterior, inferior, and draining down. And we end with the stone on our chest. Thank you so much for having me today. Take care.